Adam, I appreciate you being willing to share a little bit of your story. You and I guess, got connected way back in January, where you had kind of some specific pain. Tell me what the pain was that you dealt with initially.
The very first pain, and it wasn't even really like the pain. The first thing I noticed was kind of a transient, like minor swelling of one of my testicles, and it wasn't like it didn't even really hurt at first. As far as like it never hurt actually in the testicle, but like as it kind of went along, like I started feeling it in my back and my hip, and it just kind of progressed from there and kept getting worse and worse. But yeah, the
Yeah,
first thing was like a little bit of swelling testicle and kind of hip and back pain.
got it. And we connected for a short bit, and then you said, Jason, I just got to use my insurance. And so where'd you go from there?
Yeah, needed to switch to insurance just because of the financial issues. And I got connected with a physical therapist here who was on our insurance. And I went there and saw him for 2 or 3 weeks, and there was no change. And any didn't get any worse, it didn't get any better. Um,
What kind of things were you doing with that therapist?
so it's what I used to see a lot, like growing up when I would see physical therapists from sports and stuff, was like basically glute exercises. A lot of like single leg bridges, some adductor work, but a lot of just like hammering muscular imbalances, which I mean, as you know, I train a lot as it is. So from my point of view, is like I don't think I'm like globally weak or something like that, or I have like glute amnesia or something. I didn't really think that was kind of barking up the right tree. And I try not to like shop for doctors because I think that can be a dangerous thing as well. But I wasn't seeing any progress, so I switched to another physical therapist. Um, he was more of a running coach, running trainer, but was also a physical therapist, and that was kind of his thing, was working with runners. And as you know, I do a lot of long distance running, ultra marathons, and things like that. So started with him. Very different approach. Was working more on like not necessarily the issue itself, but what could be causing the issue. He was kind of focused more on my gait, so walking and running, and my posture, which I appreciated because it was at least different than single leg bridges. It made a little more sense to me. But again, I saw him for probably a month, and there was no real. There were slight changes. It was slightly better, but not much. In fact, it actually did at one point while I was seeing him get worse to the point where like I couldn't even squat anymore. It felt like one leg was longer than the other. So the original issue was a little bit of swelling of the testicle, hip pain, back pain. And by that point, midway through seeing the second physical therapist after you, um, it had kind of progressed to one leg felt longer than the other. I was having issues running. Running felt awkward. Walking felt awkward. My hips just felt extremely imbalanced, and I was still having the testicle issue as well. So there's a lot going on, and it just kind of progressively got worse.
Yeah. All right. So that's about what I had, because I had initially seen you early to mid January, then came toward the end of March. You're back calling me up. Hey, man, I wanted to get this fixed, but nobody can fix me down here. And so let's get together. So we got back together end of March. And then what do you remember about that process early on?
Um, we've worked for quite a bit together in the past. I think we've been seeing each other kind of off and on. Probably says more about my training. Like I just continuously get hurt, I guess, but we've been seeing each other off and on for years and years. So it's a lot of what I've seen in the past. I've just never been able to duplicate, but it's very systematic approach to um, here's whatever issue you're having. Let's kind of take you through some movements. From my point of view, what I think you're doing is kind of saying from your experience, this is what I've seen help it in the past. Let's test this movement and see if that produces any kind of change.
Yeah.
And basically, if you get a hit, you kind of run with that. And to me, it just makes it's the most logical thing in the world to me after seeing
Yeah.
multiple physical therapists.
Yeah. That test, putting it in your hands where you've got now an appreciable symptom that you can test for as we go along. That way, you know if you're getting better or not. So, what was some of that early movement that you saw start to affect your symptoms in a positive way?
I mean, the biggest one was the Cobra.
Yeah.
So I think we did a couple of different variations on it over the weeks. But basically, I would just lay on my stomach and push my chest up. And honestly, I thought it was kind of some BS. I was like, "There's no way this is gonna help all these issues," but it did. After almost no time, I was seeing noticeable progress. So, and we just kind of progressively changed or made it more difficult. I have an exercise science background, and it's just like you would with producing any kind of physical adaptation. So, as I would kind of adapt and get better at this thing, and it would produce these changes, we would make it increasingly difficult, and it would get even better and better and better. And then once we hit a plateau, we would change the stimulus a little bit. Again, almost exactly like exercise. Change the stimulus a little bit, and then eventually just nudging it along
Yeah.
until I could almost do it on my own.
Yeah. All these previous problems I helped you with, and you doubt me on that
Yeah,
pressure.
yeah. You think I learned my lesson like 10 years later, but
Yeah. All right.
yeah, every
Excellent.
time it just seems magical to me. I don't know.
So, Adam, you're now a good 3 months later. How,
hmm
how are you doing?
Great. Yeah, I still have some flare ups here and there, but it's just kind of from our previous times working together, and then this last bout, I can kind of diagnose it and treat it on my own. Because what we ended up having to do was go the alternate way. So I said we started with cobras, and we ended up having to do forward bends on the back end of that. And I got to the point where we haven't been seeing each other, and I'll still have a flare up, and I can kind of test whether I need a cobra or I need to forward bend or add in some rotation. Um, and I can just kind of do it on my own.
Worked myself right out of a job.
Yep, it's perfect. But I say that every time we work together, and I can never actually duplicate it on my own. I'm like, oh, I'll just play Jason, and it never works out that way. So,
Yeah, so before you had to shut down the running and the lifting when you were trying to sort this out early on, and you weren't getting really any changes with glute work, with gait type of modifications. We found that, okay, it seems like this abdomen, groin, thigh, buttock pain seems to all be coming from the lumbar spine. We had to compartmentalize some of your symptoms needed the extension, the backward bend, the cobra. And then we had one piece that wasn't improving. Then okay, that piece itself needs the forward bending. So, and it's just about using what you said, that test, intervene, and then retest. So if someone out there would be listening to the fact that you struggled, sought some care, didn't really get immediate response, it took some work. I mean, took 3 months to get you, where you want. Not that you weren't getting better at all. You were getting better kind of in a timely way, but it took a while. What's your big takeaway if someone else had similar symptoms and is on the fence about whether or not, gosh, I've tried physical therapy?
so kind of the point of this call is I've tried multiple other things at this point. I had injuries in high school too, and I had military background. Like I've seen other physical therapists, um, and they all kind of do like this very. They all kind of have the same playbook as far as like it's just they're. It feels like they're always hammering muscular imbalances, like glute work or that's just my most recent example, but I had knee surgery at one point, and so I feel like that one's a little different. But it was still just kind of like hammering certain muscle groups. Um, I would say see Jason immediately. um, but uh, but yeah, it's a very systematic approach, and if you just kind of trust the process and hang in there, yeah, I think you're going to see the results, and I think they kind of speak for themselves. You said it took 3 months, but I was at least seeing steady progress. Whereas with the other guys, like I wasn't really seeing much at all. Um, and I feel like you're kind of listening as we go and making adjustments as needed. Whereas the other physical therapists, like they had their playbook, and that was the playbook. Like you were gonna fit that playbook. And for us working together, it was more like, okay, if it wasn't working, I'd message you through that little portal thing, and then after 2 or 3 days, if we weren't seeing progress, we'd get on a call. Yeah, that's another good example of kind of how your process is a little different. Like we've done all this through virtual meetings, which is extremely beneficial.
Yeah.
If I'm not seeing progress, I can message you through that portal, like I was saying, we jump on a call, and you're making the adjustment. It will take a little extra time in a meeting to try to figure out what is actually going to drive the adaptation that we need to see the improvement. So, if I had like a piece of advice for somebody, just jump in and trust the process because it's going to look, to me, it looked funny. Like, I wasn't expecting a cobra to be able to fix my butt and my testicle. But it worked.
Yeah.
Sorry, I got these gnats all over.
Yeah, no, the body's interesting how it will refer like that, and it doesn't always seem logical or intuitive at first. It's counterintuitive many times, so I hear that playing with patients. But yeah, I think we don't have to worry about passing judgment on what's going on with some of these things. We just listen, we measure, we set some hard baselines. We let you tell me whether or not we're making appreciable change in the things that are most meaningful in life, and that's, I think, what's the important thing. And then getting you kind of equipped to know, I know how to take care of this. I know how to catch it earlier or reverse it and make it feel better. So I appreciate the hard work, and I appreciate you being willing to share the story.
Yeah, man, I appreciate all your help.